Good morning and welcome to the COVID-19 Emergency Response LDI Huddle Call for September 17th, 2021. You will hear layered into our recording this morning a lot of evidence of hope and improvement. And I want to go to, normally we start off with COVID key statistics. I'd like to start a little different this morning and go to Melanie Stith for our Roper St. Francis Healthcare key statistic to start us off on a good note. Melanie?
Thank you, Dr. McLean. I'm so thrilled to announce that Modern Healthcare ranked us last night as number 30 in the top best places to work across the entire country. We're so thrilled for this honor, but it's all due to the hard work of our leaders, our teammates, our physicians, our frontline. Everyone makes a difference, and we're so proud. Thank you for all that you're doing.
Thanks a lot. That's a good testament to the culture and the great collaborative teamwork that we have across the system. So moving on now to COVID key statistics with Karen Hostler.
Hey, good morning. So I'll continue on the good news. Our 14-day positivity has dropped to 19.6. 7-day is 17.8. Our 7-day average census or positive patients is 102. 7-day projected census is 160. We currently are at 159 patients, 94 in full isolation, 65 the isolation has been removed. Berkeley has 13 patients, 7 in their ICU, 1 on a ventilator, 0 ER holds. Mount Pleasant has 41, 9 in ICU, 9 on ventilators, and 0 ER holds. Roper has 57 patients, 13 in ICU, 9 on ventilators, and 0 ER holds. St. Francis has 48 patients, 9 in ICU, 7 on ventilators, and 0 ER holds. So that's no ER holds this morning that are COVID positive. Thank you for your work with that. 82% of our COVID positive patients are not vaccinated. 89% of our COVID ICU patients are not vaccinated, and 85% of our ventilated COVID patients are not vaccinated. Home care has a total of 52 patients, 49 in home health, 3 in home hospice, none in the hospice cottage, and 49 pending admissions. Thank you.
All right, thanks, Karen. Moving on to operations with Teammate Health, Dr. Gallade.
Yeah, good morning, everybody. I wanted to give the group a vaccine and exemption update. Currently, we have 1,156 teammates that are not vaccinated. We are projecting this number will go down to 800 as more teammates submit vaccine documentation. The submission deadline for submitting exemptions has been extended to September 30th. So that gives everybody a couple of extra weeks to get their exemption documentation and request in. And the November 1st deadline stands for completion of vaccination. Moving on, although we do encourage all teammates to be vaccinated, we are accepting history of having had COVID-19 infection as a basis for vaccine exemption. So if you've had COVID-19 yourself and you don't want to get vaccinated, we will accept proper documentation of previous infection as a basis for exemption. And finally, for pregnant patients, the obstetricians encourage all of their patients to receive vaccine. However, for those who do not want to receive vaccine during their pregnancies, we are giving them the opportunity to sign off on a declination statement form. Now, this is not an exemption. The obstetricians, human resources, and Teammate Health are collaborating on this statement, and that should be available by next week. That's it, thanks. I'm gonna toss it to Sarah Dietrich to give us the workforce figures. Sarah?
Good morning. We currently have 68 teammates out. 20 of those are RN job titles. 34 out of the 68 are unvaccinated. We are following 45 positive teammates right now, so that's part of that 68. 27 of those positives are unvaccinated, and the other 23 we're following are in the testing process, and 7 of those are unvaccinated. Yesterday, we saw a bump in the total number of our forms submitted. We had 31, which included a bunch of exposures from an undisclosed COVID positive patient. But we just added 12 teammates to our testing processes or positives. And we released 11 teammates to work yesterday. 7 of those were RN job titles. Thanks. Have a good weekend.
Thanks, Sarah. Doug, Brian, for an update on the vaccine clinics.
Completed our 7th first dose clinic yesterday in Berkeley, did 122 first doses throughout the 7 clinics. Just a reminder to all leaders, if you log into MyHR, switch to the manager view, and then on the bottom left item of the left panel is health and safety. That's where you can click to see your teammates' vaccination status. Please review that and actively manage those teammates showing as not vaccinated. Thank you.
Thanks, Doug. Moving on to acute care ops, Dr. Segan.
Yeah, 2 updates for everybody this morning. Number one, we're still working to complete standing up the addition of critical care APPs to the Mount Pleasant ICU. I'll be working on that today and hope to have that going live as quickly as possible, if not this week, and then potentially Monday. So more to come there. And then second of all, we did message to our surgeons yesterday that starting next Wednesday, the 22nd, we are going to, I'm just going to say responsibly, start up a very small amount of inpatient surgical procedures where obviously the patient by definition stays overnight, feeling a strong sense to be able to take care of all of the medical needs of the community. And we think the time is right based on the falling COVID census, as well as the contract labor that we've been able to put in place over the last couple of weeks. So a group of IPN physician leaders will be working this afternoon to prioritize those cases and get those on as safely and responsibly as possible. We have made it very clear to the surgeons as well as the administration and other leaders that this process is going to be very fluid and dynamic, and that at any point this process could be turned off based on the demands of the surge. But we will look at it in an ongoing basis, and again, with the hopes that we can continue to expand the number of cases that we do as the census continues to fall. That's all I have to report this morning, Chris. Thank you.
Thanks, Dr. Segan. Moving on to nursing update with Risa.
Sure. Good morning and happy Friday, everybody. Seeing some fruits of our labor around the contract nurses and respiratory therapists. So I'm really pleased to say that out of our 98 high priority positions we identified and engaged with ProLink to bring on in a rapid hire manner, they believe by today they'll be able to report out an 80% completion of those. They continue to come in. Today we had 7 start, and then so far on Monday we have 10 confirmed and 5 pending. They update us about every 12 hours, so that's a little bit of a moving target. And then on the 27th with right sourcing, we still have vacancies filling. So again, just I hope the frontline's feeling it. I know I heard it in the supervisor huddle yesterday that there are resources to spread for the first time in a couple months. So thank you everybody for your efforts on that. And no updates for the labor pool, just continue thanks for people that are doing that. It's really made a difference, especially in our emergency departments and on the COVID units.
All right, thanks, Risa. Moving on to emergency department update, Marcella.
Good morning. The EDs are continuing to see about 120% of their budgeted volumes, but the decrease in boarding or elimination of boarding in the EDs, we've been able to successfully bring down our left without being seen rates. Only 8 patients left yesterday without being able to see a provider. So we're very happy with that trend. I'm happy also to report that all of our 4 hospital-based emergency departments have been certified as geriatric emergency departments. So we really want to work in the near future on expanding the senior-friendly program for our organization.
All right, that's great news, Marcella. Appreciate that. Moving on to physician partners operations update, Kathy.
Hey, good morning. Just to share, our express care volume continues to remain high, but it is not continuing to grow, which is a good sign. The other is we have seen a decline in patients presenting for COVID testing. So we're down to approximately 300 patients a day that are requesting that service. Had been above 500 in the prior month, so definitely a note there. We're pleased to announce that we do have vaccines available now in our primary care practices. So we have Pfizer readily available. And we have requested from DHEC Moderna. So we do currently have that at Mount Pleasant Family and should have it in the majority of other practices by the end of next week. So our physicians will begin to offer vaccines to scheduled patients that are unvaccinated. As well, we will take scheduled appointments for vaccines only. And then we're awaiting for the FDA guidance. So part of our plan with the vaccines and our practices was to be prepared for the information in regards to how to manage patients requesting boosters.
Yeah, and an update on the booster. The FDA is meeting today, I believe, to consider whether or not to authorize further expansion of the EUA around booster vaccine dosing. So more to come on that probably later today, but a significant update probably on Monday. Moving on to Dr. Oliverio with a monoclonal antibody infusion update.
Good morning. A lot of good work since we talked last. We established negative pressure in the unit on the 5th floor at Roper Hospital. We got the online referral form up and running. We had provider education about that last night, and yesterday we infused our first 5 patients successfully, doing 10 today, and anticipate getting to capacity at 24 patients per day by early next week. So very happy about that, and want to really call out to recognize Bree Madre, who was really a clinical lead on site and started the program over at St. Francis, moved it over here and got it running. She's been a great resource and a great teammate to work with. So thanks to her. That's it for me.
Great to hear, Dr. Oliveira, that getting up and running. So moving on to logistics, I'll give the report for oxygen supply is stable and holding steady at all facilities. We continue to assess the capabilities for high flow oxygen at all facilities, but doing well currently. Materials update for logistics is that we have stable, adequate supply of all PPE and other materials. Moving on to a pharmacy update with Francis Wyckoff.
We have 2 drugs that are critical in need right now, and that's Tosi and Nimbex, and we're working to improve those drug inventories at all facilities. Thank you.
Thanks, Francis. Moving on to lab update with Vanessa.
Good morning. We're going to be converting over to the Sept multiplex assay over the next few weeks. We are on target still. Happy to report for our 6800 go live on September 27th. And we've worked out a plan for an internal allocation process for the LEOT supplies. And that's it for the lab.
All right, thanks, Vanessa. Andy Lyons with a public information update.
Thanks, Dr. McLean. Of course, we'll have our numbers, and then we'll also have an exemption update for teammates. We'll let them know about the deadline extended until September 30th. For leaders, we'll be working with HR on a one-pager on how they talk, how leaders can talk to their unvaccinated teammates. We'll have another nursing update, kind of like an overall roundup of all we've done to fill positions and help our teams during this third surge. We'll talk about the fact that we're allowing a limited number of procedures requiring overnight stays starting Wednesday because we have additional contract labor. We have that great news that Melanie mentioned at the start of this call about Roper St. Francis Healthcare, number 30th in the Modern Healthcare's Best Place to Work slot. We also have a photo gallery from Mount Pleasant Hospital yesterday afternoon showing some overwhelming community support. That's it.
All right, thanks, Andy. So as you heard, feathered through the updates this morning, I think we talked about the glimmer of hope previously, and I think that's spread into a beacon of hope, and I'm anxiously anticipating the dawn of hope for next week. So a lot of good things happening, all through the organization, both COVID and not COVID. And so just it's a real testament to the hard work, to the collaboration, to the teamwork, and how everybody is working together to get through very challenging times. I do want to point out that, a lot of, we've been able to take a sigh of relief a little bit here in the last few days. And I want to point out that our total COVID census is still higher than we ever saw last year. And so, again, I think that's just a testament to the organization's ability to persevere under trying circumstances and to find solutions where there were no solutions and to truly deliver excellent care to the community. So I appreciate all you're doing. Keep it up, and I look forward to talking to you next week.